Good morning, child of God. Hey, I'm Gus Lloyd, host of Seize the Day, the morning talk radio program on SiriusXM's The Catholic Channel. You know, I've spent the last 30 years of my life in Catholic radio, and over that time, I have seen the amazing blessings that Catholic radio has brought into the lives of so many people. That's why I want to ask you to join me and our friends from Ark of Heaven Media to help bring Catholic radio to Central Arkansas. We'll be having a wonderful night on Saturday, April 29th, 6 p.m. at McDonald Hall at the Cathedral of St. Andrew in Little Rock. I'll be sharing some of my stories from those 30 years in Catholic radio and asking you to lend your support to help change lives. So please, prayerfully consider it and join me Saturday, April 29th, 6 p.m. at McDonald Hall at the Cathedral of St. Andrew in Little Rock for a very special night to help bring Catholic radio to Central Arkansas. You can find out more or register online at arkofheavenmedia.org. So, I hope we'll see you then, child of God.
Thank you, Doctor, for having me. Why don't you tell us who you are, where we are, how you're connected to this place?
Yeah, well, hey, I appreciate the opportunity for this. My name is Wilbur. I'm a husband first to my wife, Lori. I'm a father, and I'm trained as an emergency physician, and I list that in that particular order just because that's how I kind of try to live my life. Live here in Little Rock now, but I'm originally a Kansas kid. Both my wife and I were high school sweethearts and met in Kansas and did our professional schooling there, and lived in Denver and then lived in Indianapolis for a while practicing emergency medicine, and had the wonderful opportunity to get recruited down to Arkansas, and I don't really see us leaving. We love it here. You know, we just love the Catholic community here. We just really love Arkansas. Where we are today, we're in the ministry called St. Joseph's Helpers, which does business as the Arkansas Pregnancy Resource Center. I suggested we meet here. This place is very special to me. When we moved to Little Rock about 8 years ago, my just immediately late father-in-law was just a profound advocate for the sanctity of life and just an amazing champion, and I just really give him credit for getting me in this work. I know God ultimately deserves the credit, but it was just through my father-in-law's witness that kind of got me into the pro-life work. And soon after we moved here, my wife volunteered for this ministry, to help both men and women who are seeking care here find life-affirming choices, to protect the sanctity of life. And there was an opening on the board of directors about a year after we moved. And so I was recruited on the board, and I just rotated off after serving 7 years. I'm the immediate past president as of a month ago. I was a past president for 2 years. And so it's funny, the majority of time here in Little Rock has been associated with this ministry. This was one of the first things that we really got involved in, and both my wife and I and our family have been involved. We're just very proud. We're just very proud of what this ministry stands for. There's something very special about the chapel that we're in today. This building is a relatively new home for us in the last few years. We used to be located just right across the street, and our center burnt down in a fire on Pentecost Sunday. We were located directly across from the surgical abortion facility. Now, of course, we're just adjacent. We're only separated by a fence, but when we had this space renovated, one of the very first things we included in the design was this chapel. And every morning, the executive director and the team of nurses and the staff come in here and pray every day. Just that witness to me was just so special, just to know that we are really nothing without him. And so this ministry it's dear to our hearts. So that's why we're here today.
Oh, fantastic. And that surgical abortion center is no longer a surgical abortion center.
Correct.
That's correct.
Yeah. The post-ops case, they stopped doing surgical abortions.
Wow. Thanks be to God. So wonderful. So we want our viewers to know all about your story of how you were called as a disciple of Christ. Maybe you could start by going way back to your childhood or sometime when you maybe explain kind of what your background is, what kind of faith you grew up in, that sort of thing.
Yeah, I'd be happy to. I appreciate the question. I was born in small town Kansas, town called Goodland, and I was baptized Methodist. My mother was Episcopalian, but was a divorced woman, and they didn't allow her to baptize her son in the Episcopal Church, and so I got baptized Methodist. But I grew up Episcopalian, and my faith was real important to me. I was quite involved as a layperson all the way through like junior high and high school, and even got involved nationally. The correlate, the importance of that is, again, I met my wife when I was 15, and she was 17. And she was a very devout cradle Catholic. And her parents, made sure to instill in her that it's very important that her spouse, her covenantal partner, is also Catholic. And early on, I sort of felt like, well, Episcopal Church kind of has the same 7 sacraments. It's pretty close, didn't see a profound need for conversion. That's the Lee Wilbur plan, of course, but God had a different plan. And so I entered RCIA really just as a way to learn more about the faith. But clearly the conversion happened in my heart even before my confirmation. And so I was converted in 1996. At the time, to be terribly honest, I was proud of it. I was proud of becoming Catholic. But looking back, it felt almost somewhat like a facade or like a label. I knew it was important, but it hadn't really entered my heart fully. That at that time I was in medical school and kind of through residency, just everything was so career focused, that my faith was over here. It was important. I mean, we went to Mass every Sunday and, I went through the motions, but I don't think my heart was going through the motions quite like it was supposed to. I had my professional life that was somewhat separated. And as that was growing, and I was getting more career accomplishments and things like that, my faith always stayed a little separate. Same with my family life. And, I'll probably discuss it later in this interview, but that kind of came to a head because they weren't necessarily in alignment, and because of that, it became evident that I wasn't prioritizing things like it should be. Like my faith needs to be number one. I would say that sometimes it was number one, but I wasn't living like it was, And so my call to discipleship, when I started to really understood what disciple meant, to follow Christ, I was looking at my life and kind of doing a life inventory that, do my actions reflect my words? Or am I just a hypocrite? Am I just like an empty promise? And kind of, sort of I was, honestly. And so things like this work here at Arkansas Pregnancy Resource Center was one of the first actionable things that I took. Where it's like, I'm going to take my own time and give it to God, give it to the church. And just sort of surrender to the process, And in doing so, there's just so many things that we've done just through this particular ministry that has really kind of opened my eyes to doing His works and correlating that kind of to my faith. I have an amazing privilege as an emergency physician. I've always worked in the inner city. And what got me into this specialty initially was to serve those that are most vulnerable and marginalized. So you would think that early on it would have connected more clear to my faith and to a path of discipleship, but it didn't until God did that for me. But, because here I am, almost essentially being a daily missionary, domestic side missionary, doing the work that I do, but not necessarily integrating it with my faith until that prayer that was answered for alignment in my life actually occurred. When that occurred, I want to lead in with, I started my career in academia, meaning I was in a university setting. I would work clinically, but I also had, research roles I would publish, and I was an administrator and things of that sort. And my career focus at that time was victims of violence. It started out with domestic violence and child abuse, and then went into elder abuse. And then I transitioned into some infectious disease work, into HIV and hepatitis C. And that was really where my career started to take a turn towards discipleship, because I felt like in order to be the most effective physician, I had to understand the shoes that my patients walked in. And I know it sounds cliche, but unfortunately, so many people in healthcare don't take that step. They don't really fully try to understand the people that they're serving. And when I did so, something spiritual happened. It's like I can use my talents or blessings or whatever God has given me to be a better advocate in addition to whatever medical training that I had. And so I started to develop programs. For those in need, but rather than create what I thought was a good idea, I actually just asked the patient. I actually had, what would work best for you, and how best can this program serve you? And to kind of realize that there are a tremendous amount of barriers that our vulnerable and marginalized populations encounter every day, that many people don't encounter. And so it's hard for some people to understand what their life is like. So I can't simply just refer them to a clinic for better care, because they don't have transportation there. They're working 2 jobs. They either have literacy issues. I have to overcome all those different things in order to do that. So that, I think, was a humbling experience in truly learning what it's like to be a disciple. That if you're really going to follow Christ, you really have to understand, first and foremost, you're doing it out of love for Him. But then if you want to be effective at doing it, you really need to understand the people that you're serving. So I think that was a big catalyst in my career when it started to kind of align with discipleship, and that's kind of how it came together.
So when I met you recently at the Arkansas Catholic Men's Conference, you had a table set up for Divine Mercy Health Center. What can you tell us about how all that came about?
Yeah, it was awesome meeting you there. I appreciate you coming over, and one of our good mutual friends introducing us. So thanks for asking about Divine Mercy Health Center. I'm the founder of that ministry. Let me kind of tell you how that came to be. A great friend aligned me with the scripture, and please don't call me a scripture scholar, so don't put that in the video anywhere. But he aligned me with Galatians 6:2, and it's Galatians 6:2 talks about if you by serving the least of Him, you're fulfilling the law of Christ. My apologies. By lifting each other's burdens, we fulfill the law of Christ. And as we talked about before, kind of in my career, recognizing the burdens that other people suffer as Catholic Christians, if there's a way that we can sort of help them with that and lift those as a community, we are serving Christ. And so Galatians 6:2 it means an awful lot to me as a ministry. So Divine Mercy Health Center came to be in a multitude of ways that I think were all providential. 100%. Looking back, God ordained this entire process. Throughout my career, as I mentioned, I'd done all these different programs, trying to figure out how best to serve one particular segment of the population, but realizing that, we could probably do this for everybody. Sure, if it works with domestic violence or sexual assault or HIV, why can't it work for everybody? Because we all suffer some of the same vulnerabilities. And I have this analogy or metaphor in my head that we're all on kind of a similar journey as individuals, that if our goal is, let's say, optimal health, physical, mental, and spiritual, simultaneously achieving our optimal health, some of us can walk that path a little bit easier. There's not as many cracks in the road. But there's a lot of our brothers and sisters where these huge cracks, almost chasms that they can't even jump over. And the healthcare system is not really set up to plug those gaps at all. They kind of let the gaps exist. And so, in short, Divine Mercy is a ministry that plugs the gaps. That's the quickest way to say kind of what we do. And if we can plug the gaps for the most vulnerable, then the system is going to be highly effective for those of us, I include myself in that group, that don't have to step over so many cracks to get to our best health. And so, at my previous job, all these thoughts were coming into play. My faith was strengthening. I was trying to figure out one of the many clinics that kind of reported through my office. I was trying to figure out how to expand the services because we were serving a very marginalized population, largely uninsured, and had a hard time integrating them into care. And so I was looking for models around the country that were successful at, treating these folks with the same high level of care that everybody else was getting. And right about that same time, separate from my efforts in this particular area, there's an awful lot of suffering that I endured by my own, mistakes and my own sins. And the beauty in that is the mercy I experienced during and afterwards. I thought I was relatively in control of my life and my pathway and things like that. That's just how I was raised, and how I was kind of conditioned in academic medicine and stuff. God had a different idea. God, he's like, you're nothing without me. And so in a very dramatic way, he showed me humility, and I will never forget it. And so through that suffering, I really experienced almost palpable mercy. Like, I've never felt it before. Like, if I could have anticipated what would happen with my family or with my friends or professionally or whatever else, it probably those things would have suffered as well, but they didn't. Like, my family unit got stronger. My friend unit got stronger and grew, Professionally, I seem to do almost a little bit better. And I give him 100% of credit because I think while he pushed me towards this humility, it wasn't, my own call to a certain extent. I was so humbled by how he took time to love me. And of course I know that he does, but that he spent that time, or that God actually saved me in just his merciful love. So anytime I read about suffering and mercy, I'm like, I experienced that. I'll tell everybody that story. Anybody who asks. Because of that, I was working on a concept like divine mercy at that exact same time, and it became very evident, again, providentially, I believe, that this needs to be created as an independent faith-inspired ministry. Not in any particular hospital entity when it first starts out, but it just has to be an independent faith-inspired mission. We put together our group about what this could look like. How do we plug the gaps? Because these are very complex things to deal with. Like, how do we do that? Our thought was all the services that people would need in this particular population, let's kind of put that in one spot, kind of the Field of Dreams model, like you build it and they will come kind of idea. And God's, of course, way smarter than we are. And so we joke that he brought us COVID, and please don't take that the wrong way. COVID was somewhat of a blessing for our ministry because it wasn't going to make a lot of sense to open up a big clinic like this during COVID. Healthcare was really suffering at the time. And I was going to the Adoration Chapel, feeling somewhat helpless. What am I supposed to do? How do I answer to the board, about where do we go? And being that non-scriptural scholar that I am, I just opened the Bible and just started reading. I didn't go in any particular area. I started reading Discipleship. And it's just funny that we're talking about call to discipleship, because that is a huge turning point in my life. When I started reading on that, I left the Adoration Chapel just empowered, energetic. Like, of course, you take this ministry to the people. Like, you don't build this, mega center. You take it to the people. You build relationships in their safe place, in their faith communities, in their neighborhoods, and everything else. And you build it up that way. And then when you assess the needs that they have, provide for them whatever they may need. And so that's really what we've done over the last 2 years. And it's been just wildly successful, and it's kind of growing every day. It's very exciting. And so we perform these medical missions throughout, or at various faith communities throughout the city as a point of entry into the ministry. Meaning it's not like a typical mission where you kind of go and serve a population and you kind of walk away. That's a point of entry where we start a relationship with you as the patient. And we have the missionary team that is serving actually comes from the parish itself. It's so cool. Like, we don't bring in this huge external team. We actually train the team from within. I just have never heard about that, but that's been really cool. To see kind of the church serving each other. It just feels like that's what the church is supposed to do. And then the church can look outside and start to serve the community. It's just really neat how that works. So Divine Mercy, in these missions, we are offering, free lab services. We do this really cool health inventory, one-on-one, very intimate interview where we're looking at so many different aspects of people's lives about, education and income and mental health struggles and transportation issues and all these things that are predicted to inhibit their optimal health. So if we can identify that up front, then we align them with our Care Connection team. And this is just an awesome team of individuals that meets on an ongoing basis with the patients to overcome those barriers and get them to reach the goals that they themselves want to achieve in the next year. They articulate to us like, hey, what do you want to achieve? Like physically, mentally, and spiritually, and let our team help you. So in the short, that's what Divine Mercy does, is we plug the gaps. We ask people what they want to achieve, and our team is in place to help them overcome all these barriers, and we've just had some really cool success to date. So
it sounds like there's really a lot of people that this is benefiting, people that are falling into those gaps. What's a typical day for you then?
Yeah.
What's that like?
That's a great question. I'm ready to retire, and I'm kidding, I'm not. But so I work full-time clinically as an emergency physician, as we mentioned. In the last 2 years since Divine Mercy kind of started to take off, I transitioned my schedule from, and as you know, we're open 24/7, so we have to cover, all day, holidays, everything else. So my schedule was always just wherever our scheduler put me. It could be a morning, an evening, it could be a night, whatever else. But that was real difficult trying to run this nonprofit, So 2 years ago, I switched to all nights. So I'm a nocturnist, is what they say. So I just work about 3 to 4 nights a week as a clinical emergency physician here in town. So that affords me almost every day to just modulate my sleep. So I can nap here and there and then do all the administrative aspects of Divine Mercy. So typical day is, as I kind of introduced myself, my initial vocation is husband. So I've got my honey-do list. So I got to do my husband role, and then I got to do my father role. And then anything medical like Divine Mercy and stuff comes third. So I try to structure my day where I make sure those priorities are kind of represented in my actions. But I just have an awesome support system. I mean, between my spouse and my 2 kids, it's really neat because the family has really been incorporated into Divine Mercy. So it's such a cool experience that it's relatively new for us. Where like the whole family is on this mission. It's not like dad goes off and does this. My wife is trained as a physical therapist and just really gets it. And so she's our spiritual rock. I mean, she's the one that really kind of reminds us of what our true north is. And every single mission we've conducted, which I think we're up to 10 missions now that we've already done. My son runs the childcare, the free childcare that we offer. My daughter works the registration desk, and gets everybody registered and prints off all their little QR codes so that we can scan them as they go from station to station. So my day is slightly crazy, but probably no crazier than anybody else's, honestly.
That's fantastic. I love that your whole family is involved.
Yeah, it's really.
So what's the best way for someone to support your ministry?
Yeah,
or your organization?
Man, I really appreciate you asking that.
Yeah.
Because as you can imagine, anybody can make an impact. No matter who you are, you can make an impact in Divine Mercy Health Center. I can guarantee it. I can just absolutely guarantee it. And what I mean by that is, even though we call it a medical mission, the vast majority of missionaries don't even have to be medical at all. Sure, if you're a doc or a nurse practitioner or a physician assistant, yeah, we'll use you as we need those volunteers for the missions and everything else. But we do so many other things. As we're assessing all these barriers, we have all this data on our patients that we're tracking. We know who's unemployed. So if we have folks that are able to employ individuals, we actually we can find out who's unemployed in those that we serve and help them get a job, So folks that are in that role could help. They have wanted, our patients have articulated that they want exercise programs, education programs, and certification programs. One, to help them with income and just to sort of elevate their families out of poverty. We've created a lot of our own already, so we need volunteers to help with that. We have 2 different exercise paths that people can take. We always need volunteers. You don't have to be trained in anything. You basically just come in love with us, Mm-hmm. So we teach CPR and first aid all over the community. Again, you don't have to be medical. You can do that. Many of our patients want English as a second language, so you can be a navigator and help with that. You can be an ambassador, so there's patients that just kind of need a figurative handhold as they're kind of going through the process overcoming these barriers. So if you just have a heart to serve, just let us know and we will line you up. Every mission we have fresh food distribution. So anybody who wants it. In our very first mission, we asked a kind of a screening question if they had suffered hunger in the last 2 weeks. And if so, hey, here's some food, our fresh food over here. But then we kind of realized there's a little bit of a stigma there. So now it's just available and people now don't feel the stigma. So we're actually distributing fresh food to sort of whoever needs it at the time of the mission.
That's wonderful.
So you can follow us on the socials. We're Facebook and Instagram currently. Just type in Divine Mercy Health Center. Our website is divinemercyhealthcenter.org. It's going through a rebuild right now, so depending on when you watch this video, it may look a little bit different, but it's getting kind of rebuilt to be a little bit more modernized. And then depending on how you distribute my contact information, you can find us at divinemercyhealthcenter@gmail.com. So, man, if you feel a calling, just say you're interested and we will put you to work. And then, lastly, we are in the process of, opening a clinic. And so our planning team is identifying properties and kind of going through the budgets, and do we go through a capital campaign to try to raise preliminary funding to get this clinic open, or do we do small business loan, or do we do a hybrid? So if one of the viewers, feels called to help us acquire a building or help us open that very first clinic, please call, because we would love it.
Absolutely. Yeah. So what about your parish? Do you want to give a shout out? Where do you call your parish home?
So my family and I, we go to Christ the King parish. Neat story. Don't know if you want it, but it's when...
Yeah, give it to us.
When we were considering moving to Little Rock, we were in Indianapolis at the time and really loved it there. Had no reason to leave, really. And so when I first presented to my family, hey, what about Little Rock? It's like, how about not? I'm joking. But, it was the very first question that my sweet spiritual rock wife asked was, well, what's the Catholic community like in Little Rock? It just tells you what she's like, And so we asked the recruiters, we're like, well, we'll consider Little Rock for the professional reasons, but if you could help have us interview, with a church, with a parish that has a school for our young children, and then for 9 years younger at the time, we'd like to talk to the principal. We'd like to look at the school, and if you could kind of set us up with a few couples that were transplants to Arkansas. We'd love to talk to the natives and everything else, but someone who's actually moved here and plans to stay here that are Catholic. And this very non-Catholic recruiting firm called us back the next day. Okay, we got it. We got Christ the King, and we have these families that are going to meet with you. So my wife and I flew down, and we were sold. We met with the principal of Christ the King, and it's like she could have spent all day with us. So we felt very special, and we got involved in the parish, and it was very, very special to us. And kind of going back to the earlier part of the interview with that struggle that I went through professionally, I kind of presented to my wife, do you want to stay here in Little Rock? Because we were here for initially this professional job. And she's like, well, no, because our rock is Christ the King. So our rock is our parish family. And we're deeply involved in a lot of the different ministries. And so a long answer to Christ the King, but that's really what keeps us in Arkansas as our parish.
Oh, wow. Fantastic. Thanks be to God. Well, Doctor, thank you so much. I really appreciate the time.
Brother, absolutely, man.
And,
Appreciate the opportunity.
Yeah. Everyone, pray for his ministry. He's
Please.
doing some great things for the community. So thank you so much.
Yeah, man. Hey, you're very welcome.